other aspects of catheter care, Coti bundle, and all those sort of thing. It's a 20-25 minutes video which I'm going to run now, and it's like I'm presenting, but it's right now a video sort of thing which you would see. Okay, so I'm sharing the screen now.
Hello. Welcome to
aspects of catheter care, Coti bundle, and 25 minutes. Yeah, so I'm starting it now.
Training session. Today we will learn about urinary catheterization. My name is Dr. Milind Chaudhary. So, in simple word, catheterization of urinary bladder is nothing but insertion of a hollow tube through the urethra into bladder for removing urine. It is an aseptic procedure for which sterile equipment is required. Now let's see what are the indications of catheterization. The primary aim of catheterization is draining urine, mostly for the patients who are unconscious or intubated, then relieving urinary retention in the cases wherein it is neurogenic bladder or obstruction or there is a clot, obtain a sterile urine specimen from a female patient, measure the residual urine in trauma patients in medical conditions like coronary heart failure or renal failure or sepsis, empty the bladder before and during or after the surgery, and allowing the accurate measure of urine. It is also an important parameter to find out residual urine for radiographic contrast studies for renal functions or urodynamics. So now when we know what are the indications when the patient needs to be catheterized, we'll understand what are the different type of urinary catheters. There are three basic type of urinary catheters. The first is an intermittent catheter. An intermittent catheter is used to drain the urine out of the bladder for a short period of time. For example, 5 to 10 minutes. It may be inserted in the patient and removed after urination. The second type is called as retention or indwelling catheter. Now these are the type of catheter which are same like intermittent catheter, but they stay for a longer period of time in the patients. And then the third type is called as external catheter, which are also called as condom catheter. These are used for very short period of time. Now let's see one by one. First we'll talk about intermittent catheter. So the intermittent catheter, or it is also called as a standard catheter, is a thin tube that a person temporarily inserts into his bladder or urethra. The external end of the tube may be left open and it will allow the urine to drain in a pan or a cup or a receptacle. Another option is to attach the tube to an external drainage bag which can collect the urine. So what do we expect? Once a person has emptied their bladder, they need to remove the catheter. It is necessary to remove the old catheter and insert a new one several times a day to empty the bladder. And usually a healthcare provider helps you understand and teach you the technique of how to do it. However, there are few side effects which comes with this. So intermittent catheters are usually pre-lubricated to reduce the discomfort during insertion. And UTI is a common potential side effect of intermittent catheter also. The risk of developing UTI increases with a long-term use of catheter. So a lot of time people use the same catheter for a longer period of time. It is ideally a new catheter which needs to be used. Still, intermittent catheter are very less likely to cause major UTIs. Another problem is hematuria. Hematuria is nothing but presence of red blood cells in the urine, which can cause the urine to appear red or brown. Hematuria is common when a person first starts using an intermittent catheter, but persistent hematuria may be a symptom of UTI. So in the first go, there are chances that it might rupture some of the other blood vessels and it could cause the blood to come in urine. But it's common. If it is persistent for a longer period of time, it can be an indication of UTI. Bladder stone, these are common in people who use intermittent catheter for a long-term basis. Ideally, it is not for long-term basis. And urethral strictures, this is narrowing of urethra that can result from repeated trauma. People who insert on their own intermittent catheter repeatedly over many months have higher risk of urethral strictures. Now we will go to external catheter and then we will come back to indwelling catheters. Now, external catheters, as I told you, some may have an option of using external catheter. This is a condom-like device that fits over the penis. A tube is attached to the catheter, collects urine back, and then it is drained out. Doctors usually recommend external catheter for males with inconvenience and who do not experience urinary blockage or retention and can use catheter by themselves only. Because external catheters do not enter the urethra, they tend to cause a very little discomfort compared with the indwelling catheters. So they are also less likely to cause UTIs because they are outside anyways. Although external catheters are for female do exist, but they're very rare. So they are mostly used for men. There are very few side effects of external catheter. Is first of all, it is only used for short-term application, and if it is used for very long term, it might cause UTIs. It can also cause damage to the penis due to friction of the condom-like material. Some people have allergy to the material itself also, and it can at any given point block the urethra. Now comes to indwelling catheters. Now indwelling catheters are most commonly used kind of catheters. So, and indwelling catheter is also similar to intermittent catheter, but as I told you, it remains for a longer period of time. One end of the indwelling catheter has a deflated balloon attached to it, something like this. And a healthcare provider will insert this end into bladder and then inflate the balloon with sterile water to hold the catheter in place. There are actually two different type of indwelling catheters. One is called as a suprapubic catheter and another is called as urethral catheter. Now, urethral catheter is also called as Foley balloon catheter, and this is the most commonly used catheter. And usually this is inserted through the urethra. Whereas a suprapubic catheter, the doctor has to surgically insert the suprapubic catheter through a small hole a few inches above below the belly button. And this operation will take place in the hospital while the person is under local anesthesia or maybe light general anesthesia. So indwelling catheters typically drain into a collection bag. A person can strap the collection bag to the inner thigh to attach it or to attach it to the stand, which is lower position to the bladder. It is important to empty a drainage bag before it becomes full, because there are chances that the urine might backflow and that can also cause UTI. For most people, this will mean emptying the bag every 2 or 4 hours. A person should also attach a clean unused drainage bag twice a day and attach a larger bag at night. Some indwelling catheters use a valve instead of a bag. Keeping the valve closed allows the bladder to fill up.
Vicky, can you go on mute?
Okay.
A person can open the valve to empty the bladder and drain the urine out into a receptacle or pan or something like that. Some people find it more convenient to attach the bag to thighs or to the inner body itself. About suprapubic catheter, many people find suprapubic catheter more comfortable than urethral catheter only because of the comfort that it is not going through the urethra and it is through the suprapubic catheter. Now, a few issues which are attached to indwelling catheters is called as bladder spasm. Now, and it is very common. What is bladder spasm is your bladder wants to remove the balloon out, a balloon section out. So there is a sphincter and this bladder would want to throw the catheter out. This can be actually treated with normal medication. Blockages are very common. So people with indwelling catheter may notice some sort of debris in the catheter tube. And this could be because of the salt deposition or some sort of blood clots or something that is passed out, which is also one of the reason of a symptom of UTI at a later point of time. Pain and discomfort, a lot of people feel pain and discomfort because it goes through the urethra. Besides, there are two type of materials which the catheter of made. One is silicone and another one is latex. Some people have some sort of allergies to the latex based material also, but if it is used for a very long period of time. Major disadvantage or side effect of this catheter is UTI, and this is one of the major reason of UTIs in hospital, which is also called as catheter associated UTI, which will come in the next session. So there are different sizes of indwelling catheters. Now, when we talk about sizes of indwelling catheter, they are actually measured in French sizes. So French size is nothing but a unit to measure the internal diameter of the catheter. And one French is equivalent to 0.33 millimeters in diameter. So for example, if you have a 18 French of catheter, that means the catheter's internal diameter is 6 mm. The smaller the number, the smaller the internal diameter, as simple as that. And it is also given with a color coding for easy understanding. And this color coding is actually represented on the catheter's valve end. Every catheter will have different color coding, and from that color coding also you will be able to gauge which it is. So for example, in this it is orange, it is a 16 French catheter. Now usually smaller catheters are for pediatric patients. So for example, number 8, 10 are used in children. From number 14, 12 and 14 are used in females mostly. 14, 16, 18, 20 are used in male patients, and then above are used in some rare conditions wherein there is more stiffness or something needed. Now the balloon also have larger capacities and volume. It also depends on the bladder size. A very standard size of insertion in the balloon is 10 ml usually, which is usually the standard catheter which is used. And it can increase depending on the bladder size, but that is usually defined after a thorough sonography, and it's a physician's decision to insert the amount of liquid in the balloon as much as depending on the patient's condition. Now let's move to catheterization part itself. Now catheterization is a very standard procedure, yet it is a very critical procedure which requires completely aseptic conditions and need to be performed by a trained nursing staff or a doctor. So when we are talking about preparation of the catheterization, there are few things that you have to start with doing. So infection is a major risk in urinary catheterization. That is why you have to start preparing stuff. Then for that, what are things you are going to require is you are going to require an antimicrobial catheter, a 10 cc syringe, sterile water, cotton balls with iodine, lubricant, sterile gloves, proper lighting in the place, urine collection bag, a Velcro strap and anchoring tape, and a disposal bag. Now, once you arrange all these things in tray, in few companies also offer a tray kind of solution in which all the other things are available along with the catheter. Right now, using antimicrobial catheter will reduce the chances of infection to a much larger extent. Though there are still chances that the infection can come through any of the other issues which are happening during catheterization. The first thing that a nursing staff or a doctor will do is actually explain the procedure to the patient and provide a complete privacy and adequate lighting. Now, the insertion of the catheter differs in male and females. We are only talking about indwelling catheters right now. And when you want to position a female patient, then a female patient needs to be in a dorsal recumbent position with knees flexed and feet about 2 feet apart. The body needs to be upper body, and each leg needs to be covered. Then place the catheter set between the female patient's leg, and then you can start with the procedure of insertion of the catheter. Whereas in the case of male patients, male patient needs to be in a supine condition. Then drape the patient's body around the groin region. and then you can start inserting the catheter. Now, how do you start inserting the catheter in a male patient? There are few steps which are very common in whether it is a male patient or a female patient, which are you have to cleanse the genital peritoneal area, and for that to start everything, the first important thing is you have to maintain sterility to the highest level. So you have to wash your hands, put on gloves. Then in male patients, usually cleanse the genital and peritoneal area with warm soap water initially to do it, rinse and dry. Then you have to wash your hands carefully, and then you open the sterilization kit or sterilized catheterization kit or all the things that you have around you. Then you wear a glove and open the sterile drape and place it onto the patient's thigh. Apply sterile lubricating jelly to the catheter tip, like this, and you have to generously apply the lubricating jelly to the catheter tip so that the insertion is easy. Then what you do is you take the start catheterization procedure, and for that you have to gasp by one hand. You have to gasp the patient's penis and retract the foreskin if the patient is uncircumcised. Now your glove hand has actually touched the penis, so it cannot be used for touching the other sterile material. So with the other hand, you take the catheter which you have already opened and put on lubrication to it, and then you start pushing the catheter inside the penis. Now for this, the penis needs to be in a 90-degree angle, and advance the catheter into the patient's ureteral meatus, the whole opening that you would see, and lower the penis and continue to advance the catheter. You have to note that never force the catheter to advance. And if there is any kind of unusualness or discomfort, and if it is not getting inside, you have to stop the activity immediately and get assistance from the nursing or the physician staff. When the catheter has passed through the prostatic sphincter, which you will feel, which the person inserting will feel, gently insert until 1 to 2 inches beyond when the urine is noted. And the moment you start the urine flowing out of the catheter, then you start inflating the balloon. Usually 10 cc is inserted into the balloon. Then gently pull the catheter out till the inflation balloon is in place inside the catheter. And then you anchor the catheter tubing to the lateral abdomen, wherein you can tape it without tension on the tubing. Then place a drainage bag below the bladder level. Attach the drainage bag and place it below the bladder level, and you can properly insert it and attach it, anchor it to the patient. Now after this, you have to carefully remove your gloves, dispose all the equipment, and write down and note down the time of catheterization. If required, the initial urine sample is taken as a sterile urine sample if it is prescribed by the physician.
Now, I hope you guys are clear with all the parts of catheter. So for example, here in this 2 photos, it is very clear that what is the function of these 2 ports basically. One of the port where the syringe is attached, there is a valve at the end of this port. Basically, it is a non-returnable valve. So you can push in fluid inside and then it is locked. And when you want to drain the fluid out, the fluid can be out. Now this tube which is going is actually not the part of the tube which is coming, which is draining the urine out. This is a separate tube which is attached to the catheter later on, typically during the manufacturing process. So what this tube is doing, this is injecting fluid in the balloon part of it. The balloon that you see, which is typically inserted inside the bladder. Now the balloon is inflated with liquid so that the catheter is held inside the bladder, because otherwise it can just simply come out. So just to hold the bladder inside, there is a balloon which is inflated. So this is a non-returnable valve kind of port. This is balloon inflation port. The second port that you see is actually the tube which is coming from the bladder and the eye is punched to this tube. So here the attachment that you see is actually a urine bag attachment which is done. So typically from the eye, the urine is drained through the across the tube and which is coming out from this tube. So from an infection point of view, this is the tube which is the most important one, because when the patient is either orthopedic surgery, traveling time and something like that, the urine typically comes back from the urine bag, and then it can cause infection inside the bladder. That is part number one. And second, this is called as a closed loop. If this closed loop is compromised, because here, if the nursing staff glove touches, and that glove has been touched to, let's say, urethra, or in female cases it could be to the female fecal contamination or anything, the bacteria gets entry. This is called as intrinsic entry of the bacteria. We'll touch upon that again, but just to telling you, there are two types of entry. One is outside of the surface. Typically what is going to happen, the bacteria from the skin comes down to the catheter, and because the catheter is going inside, they are going to walk along the catheter inside. This is from the outside surface of the catheter, called as extrinsic infection. And if any nursing staff touches their hand while attaching the urine port, the bacteria gains entry inside the catheter, and that is called as intrinsic entry, intrinsic infection. We'll touch upon about the infections later on. So this is what I wanted to add.
Now, how it is being inserted in the female patient. So the process still, the cleaning of the hands and preparing the catheter is same. Post that, you have to clean the, so place your thumb and forefinger of your non-dominant hand between the labia minora, spread and start upward spreading. So the glove hand has touched the patient now, so it is contaminated. So you have to use a forceps, pick up a cotton ball, saturate it with antiseptic solution or iodine, and use one cotton ball for each stroke and just throw the cotton ball. With the swab, you have to carefully clean the whole meatus downward towards the rectum. Then, keeping the labia separated, cleanse each side of the meatus in the same downward manner. Do not go back over any previously cleaned area. Then deposit all the cotton balls in the disposal bag, and after your last cleaning, deposit the forceps also in the disposal bag. Then continue to hold the labium apart after cleansing. Insert the lubricated catheter into the female patient's urinary meatus. Very carefully. Angle the catheter upward, and it is advanced. If the catheter will not advance, instruct the patient to inhale and exhale slowly, and then it will will be inserted. This will actually, the breathing will relax the sphincter muscles. Do not force the catheter. When urine starts to flow out, insert the catheter approximately 1 inch further. Then place a cup under the stream, and if you want to collect the urine, you can collect the urine at this point of time. Then inflate the balloon using the correct amount of sterile liquid. Again, 10 cc is very standardly used. And then gently pull the catheter until the inflation balloon is snug against the bladder neck. So it is in place. Now the catheter is in place. Connect the drainage back to the catheter. Secure the catheter to inner aspect of the female's thigh, and place the drainage back below the level of the bladder. Again, you clean your hands, collect the specimen. In both the cases, it is recommended to observe the urine for some time, whether there is some sort of color, odor, or quality of the urine, so that you would know if the patient is already UTI positive, or if not, if there is any problem in the insertion of the catheter. Now, this is up to insertion of the catheter. Now, once the catheter is inserted, how do we maintain the Foley catheter? So again, for maintaining the Foley catheter, same precautions needs to be done, because this Foley catheter is going to be inserted in the patient's body for more than 2 days or something like that. So every day, or in every 2 days or 3 days, you have to take proper precautions to maintain the indwelling catheter in place. So what you essentially do is clean the perineal area with soap and water twice, and after each bowel movement, especially around the meatus area. Use a separate area of cloth for each stroke. You have to completely avoid the use of lotions or powder in the perineal area. Arrange for a patient to take shower in the tub bath when permitted. The container may be hung over the side of the tub if you are actually taking the patient for bathing or something. The catheter should be clamped temporarily if the collecting container is higher than the bladder, because there are chances of urine backflow and which can cause UTI. Teach the patient to maintain the catheterization, and self-care helps the patient to develop the feeling of independence that actually promote cleanliness and hygiene. If the patient is ambulatory, then you have to instruct them to use the catheter leg bag, which will help them for easy walking, and otherwise they don't have to handle the urine bag above the bladder portion. Encourage the patient to take around 2500 to 3000 cc's of fluid every day, and change the indwelling catheter as necessary or in accordance with the policies of your hospital or as prescribed by the physician. Now, once the catheterization period is over, how do you actually remove the catheter? So, for removing catheter, you have to follow all the aseptic procedures. And for that, the first step starts with assembling all the supplies and equipment you require for doing this. So you start with a 10 cc syringe, washcloth or a towel, examination gloves, soap and water. Identify the patient and explain the procedure to him. Explaining the procedure will help you for easily removing of the catheter. You have to tell them that it is going to be a slight burning sensation while removing of the catheter, which is obvious because the catheter is there for a longer period of time. You have to provide a proper privacy for female patients, and the female should be again in a recumbent position and the male should be in a supine position. Now, what you essentially do is you wash your hands again for sterile conditions and put on the examination gloves. Empty the balloon by inserting the barrel of the syringe and withdrawing the amount of fluid during inflation. So ideally, if you have inserted 10 cc, the 10 cc should come out and the balloon will be completely deflated. So then what you do essentially is pinch off and gently pull the catheter near the point where it exits from the meatus. Then after the removal of the catheter, clean the perineum and penis with soap and water, dry it completely well. Then again do it inspect the catheter to be sure that there are no remnant of the catheter remaining in the bladder, because in some cases the balloon deflation may actually cause, if there is some salt deposition or something on the catheter. So you have to completely inspect the catheter. If there is UTI, you have to inspect the catheter and see if there is any kind of smell, foul smell or anything that is coming out of the catheter. Usually you empty the drainage bag and you start measuring the urine every single point of the time. Then you dispose the urine bag along with the catheter and other supplies which were there. Carefully record the time of catheter removal and time and date, and by who it was removed is also important. And again, assess the patient for 24 hours after the catheter removal. You have to also note that the patient needs to be observed for 8 to 10 hours. And if there are problems like inability to void the bladder or frequency or burning or dribbling kind of situation, or if he's hesitant to starting the stream of urine, or if there is kind of cloudiness or any other unusual color or characteristics of the urine, if you see, this needs to be reported and immediately there are medications which can be started to the patient. Provide a level of fluid similar to the intake when the catheter was in place, which was around 2.5 to 3 liters of water, and record that the catheter was removed, date and time, and by whom. So this was all the information about catheterization. So we have learned how to insert what are the different type of catheters, why the catheterization is required, how to insert the catheter in both the type of patients, how to maintain them, and how to remove the catheter. Then